Hi, how are you?
I'm good. How are you?
I'm good. My name is Lena and I'm your student nurse today. Let me close the curtain for you.
Okay.
Okay. Wash my hand. Can you tell me your name and your date of birth, please?
Selena Raspandari, September 3rd, 1996.
Hi, Miss Lena. My name is Lena and I am your student nurse and I'll be doing your head to toe examination today.
Okay.
Okay, the bed is at its lowest, the suction tube, oxygen tube, and the call button is on reach. Alright, so before beginning the process, let me explain you what we're going to do today, okay? So it is a head to toe examination, so I'll be performing a physical examination and collecting some of the subjective data, okay? And before I begin, I'm going to take your vital signs, which is your pulse, respiration, and blood pressure.
Okay.
Okay, so let me begin with pulse. Alright, Miss Selena, I took a minute of your pulse and a minute of your respiration. Your pulse is 84 and your respiration is 18, which is normal. Now I'm going to take your vital sign. I'm going to take your blood pressure. Which hand would be?
This one.
Great. Okay, thank you. Let me know if it's too tight for you, okay?
Okay.
Let me just put it up here. Great. Great, Miss Selena. Looks like your blood pressure is 100 over 60, which is normal. Okay?
Okay.
Great. Alright, now I have a couple of questions for you. Miss Selena, do you have any allergies, medicine, food, or any seasonal?
No.
Great. Are your immunization up to date?
Yeah.
Great. Have you got your flu shot this year?
I did.
Good. Do you feel any headache, dizziness, nausea, vomiting?
No.
No. You have any change in your vision in past couple of weeks or month?
No.
Good. Do you have a history of chest pain or any abdomen pain?
No.
Good. Do you ever feel shortness of breath or anything?
No.
Good. Do you smoke, Miss Selena?
No.
Great. How about your do you notice any change on your skin, like any rashes or lesion or cuts?
No.
That's good. That's good. Have you have a history of fall?
No.
Do you feel weak or weakness sometimes? Good. Do you have any pain on your joint or muscle
No.
or any bone pain? Great.
No.
When was the last time you pooped?
This morning.
So was it watery or it's good,
Consistent.
consistent?
Yeah.
Okay. How often do you poop?
Sometimes 2 times a day. Usually one.
Okay. How about peeing? How often do you pee?
Like 4 or 5 times a day. Morning if I drink a lot of water.
Okay. All right. Good. Do you have any family history of cholesterol?
No.
No. Okay. All right. Or any family history? Anything that you want to know?
No.
No. Okay. Great. All right, Miss Miss Selena. Now I'm going to perform a head-to-toe examination, as I said before. So I might need to inspect and palpate your head or any part of your body. Okay.
Okay.
So I'm going to begin with your head. All right. So I'm palpating your head for any abnormal masses or any tenderness. Oh, you've got a great scalp.
Thank
All right. As I palpate, I do not see any masses or tenderness. You don't feel any pain, right?
No, I don't.
Great. Any masses or tenderness or any abnormal in a head skin. All right. Miss Selena, I just want to repeat myself again. Do you know what time it is on the day? Morning, afternoon?
Morning.
All right. Do you know where you at?
In my living room.
And do you know what month it is?
November.
Okay. Patient is well oriented and she has maintained the eye contact. So on a Glasgow Coma scale, I would rate her 15. All right, Miss Selena. Now I'm just gonna ask you a couple things to do for me. Okay? Can you wrinkle your forehead for me? Good. Can you puff your cheek out? Okay. And can you smile? Great. I just looked over her cranial nerve 7. Now, Miss Selena, can you rotate your head over the left? Great. And how about now on the right? Great. Can you sit laterally? Great. Just can you shrug your shoulder up? Great. Oh, that's a lot stronger. I just observed her cranial nerve 11. And now, can you stick a tongue out for me, please? Great. Can you rotate your tongue left to right? Oh, great. Now I observe cranial nerve 12 and the reflexes are normal. Now, Miss Selena, I'm just gonna check on your eyes. So the room light is pretty dim, so it'll be fine. So can you look over my nose or my shoulder when I put the light on your eyes? Okay? It might be a little bit bright, but it'll be fine. Great. Good. And now please look at the tip of the pen, okay? Great. Alrighty. So her pupil is round, reactive to light, equal, and well accommodated. Alright. Alright, Miss Selena. Now I'm going to inspect and palpate and auscultate your carotid artery, okay?
Okay.
The skin color on a head and a neck is warm, dry, and consistent to ethnicity. I don't see any lesion or rashes. Alright, now I'm going to palpate your carotid artery, but it's one at a time, okay? Alright. Great. Alright, I just palpate the carotid artery. The pulse would rate a 2+ is strong and regular. Now I'm going to auscultate your carotid artery. Alright?
Okay.
The same thing, one at a time. This side. I just auscultate your carotid artery, and during auscultation I hear no bruit. Alright, Miss Selena, now I'm going to inspect, auscultate, and check on your thorax, okay? Normally when we do the thorax examination, we take our clothes inside the clothes, but for the patient privacy, we'll just leave it on for you, okay? Alright, Miss Selena, just relax and sit back, okay? Now I'm going to put my hands right above your abdomen to measure your breathing, the chest expansion, okay? Great. Can you sit laterally? Thank you. Take a deep breath. Can you do it one more time? Thank you. The chest expansion is symmetrical, anterior and posteriorly. I do not observe any shortness of breath or any labored breathing. Alright, Miss Selena, now I am going to auscultate your lung sound, alright?
Okay.
Let's begin with the clavicle. Take a deep breath. Okay. Okay, now on the lateral side. This side. Take a deep breath. Alright, now I'm going to the posterior, I'm going to listen to your posterior part of your lung sound. Can you, yeah, thank you. Take a deep breath. Take a deep breath. One more time. One more. One more. One. Alright, great. You can sit straight, Miss Selena. So if the lung sound is all clear, I do not hear any adventitious lung sound. Alright, now I'm going to listen to your heartbeat, okay? So I'm going to auscultate your heart. Now I'm starting with the aortic, which is on the right sternum border. Okay, I'm going on a pulmonic, left sternum border. Going on a tricuspid, lower left sternum border. And going on a mitral, on a fifth intercostal muscle on the Alright, great. So I did not observe any kind of murmur, and the heart sound is S1 and S2 is heard. Okay. Alright, Miss Elena. Now, so the skin on the chest is warm, consistent, and consistent to ethnicity, and no lesion or any bruises observed. Alright, and now I'm going to inspect your abdomen. Can you lie down for me, please? Thank you. Lift up the shirt for me. Thank you. While inspecting the abdomen is round and non-distended. I would say it's a flat. And the skin on the abdomen is warm, dry, consistent to ethnicity, and no cuts, lesion, or any bruises observed. Now I'm going to auscultate her abdomen with a fourth reason: right upper, right lower, left upper, and left lower. Now I'm going to auscultate a vowel sound starting from the right lower quadrant. All right. I'm going on the right upper, left upper, and left lower. Okay. On each quadrant, I listen the vowel sound for 5 minutes, and for the vowel sound, I listen to each quadrant for 5 minutes. Okay. And all right, Miss Selena, now I have to light palpate on your abdomen. Okay.
Okay.
If you feel any tender or any pain, you just let me know. All right. Do you feel any pain here?
No.
Any pain here?
No.
Any pain here?
No.
Any pain here? No. Thank you. During palpation, the patient expressed there is no tenderness or any pain on the abdominal region. All right, Miss Elena, can you sit over? Now I'm going to check on your upper and the lower extremities, okay, which is your hands and the feet. Now, while observing your hand, the skin is warm, dry, consistent to ethnicity, and no cuts, bruises, or any skin rashes observed. Alright, now I'm going to check on your capillary reflexes on both of your hands. It is less than 3 seconds. It's normal. Let me check on your pulse. The pulse is regular and strong. I would rate it +2. And yeah, it's good. Alright, Miss Selena, now can you squeeze my finger a little bit tighter? Great. Alright, can you put your palms up and try to press my hands against the ceiling? Alright, great. Now you put it on, against the floor. Great. Alright, so can you lift up your arm for me, please? Like this. Thank you. Put it down. Can you put your legs, hands away from your body and then put it down? Alright, so patient has full range of motion, and on a strength scale, I will rate her 5 on upper extremities. Alright, now I'm going to check on your lower extremities, okay?
Okay.
So, the skin on the leg is warm and dry, and the skin color is consistent to ethnicity. I'm going to check on the dorsal pedis pulse, okay, and posterior tibular pulse. The pulse seems, I would say it's +2 and regular, it's palpable. Now I'm going to check on the capillary reflex on a toe. It's less than 3 seconds, normal. Alright, Miss Selena, let me put my hands on your feet, and then can you press it like you are hitting a gas pedal? Great. Can you lift up your toe up? Great. Alright, now, that's good, thank you. And can you lie down one more time for me, please? Yep. Great. Now, I'm just going to ask you to lift up your feet, lift up your leg, and press it against your stomach. Have any problem with that? No. Can you put it on this side? Great. How about this one? Great. Any problem? No. Great. Alright, now you can sit up, Miss Selena. So the range of motion on the lower extremities, I would say she is full range of motion, and on a strength, I would rate her 5. Yes. And everything seems fine, Miss Selena. Thank you. And the call button is right next to you. If you need anything, I'll be here.
Okay.
Thank you very much.